Do that. Okay, let me make sure we're going live here. Maybe. Okay, so we are live. Welcome everyone to the Mom and Baby Nutrition Support Group. My name is Alex Gardner. I'm a registered and licensed dietitian nutritionist. And as you guys know, if you've been in the group for a while, we go live every week to talk about topics that are asked by moms a lot or that are of special interest. And so today I have a special treat for you guys. We have Lauren Miller, who is an occupational therapist and a certified lymphedema therapist with us today. And so Lauren is actually from Florida, but she's now living in Knoxville, Tennessee. And she recently started her own mobile practice to treat clients how she believes they should be treated. Her passion is really spreading awareness and education on the importance of the lymphatic system and how MLD can help so many people. And so thank you so much for being here, Lauren. I really appreciate it.
Thank you, Alex. I'm excited to be here.
Of course. And so, before I met you, I didn't really know much about this space and the benefits it has on women's health. So I guess first, let me just ask, if you could tell us a little bit more about yourself and how you got into doing what you're doing.
Absolutely. So, like you said, I am from Florida, born and raised in South Florida, and I'm an occupational therapist, and I had been doing that for a very long time, and then had a couple of kiddos, especially my last one. She was born right before COVID, so took some time off from work. And when it was time to come back, I had an opportunity to take the certification course for certified lymphedema therapist. And once I took that course and I learned about the lymphatic system, there was just no looking back for me. No more OT, even though, yes, it is still part of OT. But I really just learned so much about the lymphatic system and how it really is not well studied. Even physicians don't know very much about it. So it kind of took in my passion for helping people and also educating people. So it's my favorite part of it.
So in the spirit of education, so for those of us who might not know, what exactly is the lymphatic system? Just general overview.
Yes. So the lymphatic system is very lovingly referred to as the sewer system of the body.
Okay.
So basically, lymph is made up of water, protein, and cell waste. So our tissues receive water and protein and nutrients from our blood. They use up whatever they need. There's extra water and protein, and then they make cell waste. So our lymphatic system comes into play because it takes up all of that extra lymph and it transports it to lymph nodes to be cleaned, and then eventually back to the bloodstream and down to the kidneys and urinated out. So that's a very brief description of the lymphatic system. But basically, its main functions are to transport toxins, it transports immune cells, it transports hormones throughout the body. In the abdomen, it transports fatty acids. And then the lymph nodes themselves make lymphocytes, which are part of our immune system as well.
Okay. So is that why when you get sick, you get swollen lymph nodes?
Yes.
Okay. That's
Exactly.
interesting. Okay. That's really cool. I'm learning a lot of things too.
Yes.
So when you talk about the lymphatic system and everything that's going on, how does that influence pelvic health?
So it's really interesting, and this is kind of a newer path for me. In the certification program, it's all lymphedema, which is a very specific condition, typically following breast cancer surgery. Those survivors will have it in their arms, vascular issues in the legs, that sort of thing. And so that course was really geared towards treating that. Now that I'm on my own and I am able to take more courses and learn more things, I'm learning how the lymphatic system really is connected and works with all the other systems of our body. So for pelvic health or pain, um, I'm going to digress for a second. We
Okay.
have our nervous system. So we have our parasympathetic nervous system, which is like a state of healing and rest. And we have our sympathetic nervous system, which is more like fight or flight and survival mode. And so, not to go into like the pitfalls of society, if you will, but society nowadays is very fast paced, stressful. So we all kind of hover in like a low level of like our sympathetic nervous system. And what we find is that it often leads to kind of like a guarding and anxiety, and everything tenses up in there. And on top of that, any inflammation, scar tissue, like from C-sections, any abdominal surgeries, if you have any like inflammation or any of that stuff, can really have an impact on the pelvic muscles and also any of the nerves and the blood vessels in like our abdomen and pelvis.
Hmm.
So, yes, that was a lot. But basically, what's happening is when our sympathetic nervous system is on, we have digestion is slowed, blood flow to the reproductive system is decreased. And so it's kind of almost like our pelvis is frozen, if you will. So the benefits of the manual lymphatic drainage is that it has an analgesic effect, so it decreases pain, but it also has a relaxation effect to it. And so it can bring us from the sympathetic to the parasympathetic and allow everything to kind of loosen up in there, not be so compressed, and start flowing the way that it should be flowing.
That's really interesting. So when I hear lymphedema, I think like you're swollen, like things like that. So if you like, do you have to be swollen or do you have to feel bleh to do this like manual lymphatic drainage that you're saying, which is like just a massage? Um, or is it good for anybody, even if you feel like you're fine?
I love this question because I always say, well, we all have a lymphatic system and
Okay.
it could always be shown some love, right?
True, true.
A lot of us are stressed. Some of us are more sedentary than we'd like to be, all sorts of things. So it really is appropriate for anyone, even if you aren't feeling blah or you're not having visible swelling. Um, just the benefit of having it done kind of helps the whole entire body, muscles, skin, acne, sinus congestion, all sorts of things. We could play like a game and people can like throw out like this and I'll be like, yes, or how about that? So
So
there's
how
really,
is that different from like a regular massage?
so I love this question too. So the technical term is manual lymphatic drainage.
Okay.
So interspersed, we say lymphatic massage just as like a
Oh,
general
okay.
term, if you will. So our lymphatic system, there are two parts: deep, which is basically lining our organs, and then superficial. And so the superficial lymphatic system is right underneath our skin.
Okay.
So when we do manual lymphatic drainage, it's a very gentle technique. It's not like a get your elbow in there and like
Okay.
deep pressure. It's very light, but it's specific strokes and it's specific directions and sequences that we do. We know how the lymph flows, so we want to direct it in the way that it goes and the route that it takes.
Okay. So does someone have to go find a certified lymphatic therapist? I mean, they should, but if there's not one near them, what can moms do?
So thankfully, there are more and more of us around, which is great, but still pretty few and far between. So there are some really great YouTube videos on how to do self massage for all sorts of different things. Um, there is just a general, like, big six, we call it, where you're hitting 6 areas that are really important for the manual lymphatic drainage that if you were to do every day would help at least in some degree, without having to be like super specific into
Okay.
whatever's bothering you.
So when you're saying like a gentle massage, what does that look like for moms or women in
So,
general?
like, yeah, so when I see somebody, since I'm mobile, like you said, I show up with my little massage table and I get it all set up. And the beautiful thing about our lymphatic system is pretty much everything drains to the front. So
Okay.
it's not like a typical massage where you're face down, you're actually on your back. And we always start at the neck, right here behind our collarbones, because that is the end of the lymphatic
The
system.
end. Okay. Interesting.
So if you think about it, you have a traffic jam. You're not going to try and ram cars through it from the back,
Okay.
right? That you could. It's
Yeah.
not going to go well.
Yeah.
So you need to clear it from the front. And so the lymphatic massage, we open up all of the channels and then we work our way down basically, and then we work our way back up to push the fluid through the channels that we just opened.
Okay.
So we always, always, always want to start at the neck. Um,
Because
and that's
that's
kind of a
the
giveaway
type of
if you're
talk.
like,
It's got to go through it. Okay. It's
yes,
got to go through the neck. Okay. Okay.
yes, exactly.
Okay.
So if you're seeing somebody and they're starting at your hands or your feet, that's kind of a red flag, like,
Oh, okay. Okay.
because you do not have to be a certified lymphedema therapist to do the manual lymphatic drainage, but I always recommend checking people's credentials because
Of course.
it's important.
Yeah.
There's people out there doing crazy things. So, anyway, we always start at the neck and it's very gentle pressure. Basically, I'm going to show you if you can see my arm. It's very
Yes.
pale. And you can see my skin stretching behind my hand, right?
Mhm.
That's all we're trying to get is that little light skin stretch.
Okay.
So, if we do deeper pressure, it actually has the opposite effect and it
Okay.
compresses the lymphatic vessels.
Okay.
Yeah,
Okay. That's really, I'm learning so much. Oh my
I
God, I'm learning so much.
yes.
So
So,
actually, there's a question in the chat on
okay.
if pregnancy increases lymphatic flow or decreases it.
So pregnancy, the thing with pregnancy is it can decrease it because you get a big old beautiful belly and that can kind of hinder lymphatic flow from the legs up through the pelvis because that is the track that it takes. So that could limit the flow. What's really happening in pregnancy is we have an increase in the amount of blood that we are producing.
Okay.
And very long science story short, when there's more blood, there's more lymphatic fluid.
Okay.
And so as our blood volume increases and we become a little less active because of that big, beautiful belly, then what we see is an increase in the lymphatic fluid, and the lymphatic system just can't quite keep up. And
So is
so,
that why moms get swollen feet or
yes.
okay. Oh my
So
God, we're getting
gravity
the things.
is
Getting
not
the
our
things.
friend, and it will make any fluid sit and pool in the lowest place, which is
Okay.
typically our feet and ankles.
Okay. So lymphatic massage would be really beneficial for moms like when second trimester when they're or like second half of pregnancy when they're starting to get swollen.
Yes.
Okay.
Yeah, I mean, they could do it anytime, really. I tell mamas that I treat, they're good all the way up until they deliver that baby and the next day,
Okay.
as long as there are no complications.
Yeah.
So since we are pushing fluid to the heart and the kidneys, there are some contraindications, meaning we don't put our hands on you. If you are having like preeclampsia, any high blood pressure issues, any kidney issues, blood clots, that sort of thing.
That's really interesting. So when you were saying like, okay, so if we're talking about swollen feet, sometimes moms tell their partners, please just rub my feet. Like that's all I need you to do is rub my feet. And I know my husband, if he were to rub my feet, would like put his knuckles in there and do all that. So not like you don't want to do knuckle in the bottom of the feet, just a light little thing.
Well, listen, there are all sorts of modalities, right? So the deeper pressure massage certainly has its place if you're having muscle issues. I'm an OT, so like feet are not my thing, but any like tendon issues, plantar fasciitis, then yes, you would want to do deeper pressure. But if you're working on the swelling, you would want to do light, gentle, kind of short, like semicircle strokes from the foot up towards the knee, is basically kind of the general gist
Interesting.
of it.
Wow, I love this. I'm learning so much. Okay, so we hit on pregnancy and swollen feet because that's a big problem. We hit on
Yes.
pelvic health and general wellness with that. What about for breastfeeding? Does that have anything to do with it?
Yes. So our breasts have a vast network of lymphatic vessels. And the lymphatic vessels run right along with all of the mammary glands and mammary vessels. And so when we are pregnant, and just when we're females and we have estrogen and progesterone, and with our monthly cycle, these hormones are fluctuating, what happens is estrogen and progesterone actually stimulate the ducts to expand, and then it retains fluid in the breast. So again, swelling, lymphatics,
Mm-hmm.
we can do the manual lymphatic drainage for the breast. And what that does is it helps get rid of any of that extra swelling that's just kind of sitting in there. And this can help prevent engorgement, clogged ducts, um, mastitis if it's caught early. And it has been shown in some women to increase the breast milk supply. It
Okay.
did for me.
Okay. Because things are getting unclogged. I can see that.
Exactly.
So you also talked about like with your monthly cycles, and I know like some women get extremely crampy and bloated and stuff like that when it's time for their period. So like doing some self lymphatic massage or lymphatic drainage would help with that then.
Yes, absolutely.
That's
Yep.
very
I
interesting.
even was just learning about how it can help with endometriosis.
Mm.
Um, super a little off topic. I'll be quick,
No,
but
go do it. I want to hear. I'm
endometriosis,
super excited.
it's all of this is so fascinating to me. So with endometriosis, basically what's happening is the inner uterine cells are leaving and they are now outside of the uterus in
Okay.
various areas. And so they're actually finding that those cells can travel through the lymphatic system.
Okay.
Now we know that the lymphatic system helps with immunity and transporting immune cells. And
Okay.
so when we stimulate the lymphatic system through the self massage or MLD with me, it helps our immune cells attack those endometrial cells where they're not supposed to be and destroy them. Yeah, it's amazing, right?
Wow.
So
Does it
it
have
has
any
been
connection to
found. Huh?
PCOS? Does
I'm
it have
sorry.
does it have any connection to PCOS?
It could. Yeah. So
That's just
the
so
thing with the
cool.
lymphatic system is there are studies being done, but they're few and far between and they take a while. And so a lot of this is kind of just like, let's try it and see if it helps. And we have anecdotal evidence.
Yeah, that's really cool. So it seems like it's like a new, like a baby science where there's a lot of emerging research on it. That's really, really, really fascinating. Obviously, I'm a science geek, so I find a lot of this interesting too. Um,
Yes.
so we talked about breastfeeding and menstrual cycles and endometriosis and all these things. So what are some of your favorite things to educate moms about on this besides like what we talked about? Because I know you had a lot of things you're like wanting to say.
I know. I could talk about this all day, which is cool. That's now my job. Woo! Um, Basically, when you're pregnant, some of the things that'll really help everybody, pregnant or not, you always want to be drinking a lot of water.
Okay.
Water helps to kind of thin out the lymph fluid. So normally it's kind of thick between like molasses and maple syrup.
Okay.
So when you drink a lot of water, it helps to thin it out, which then helps it to flow better. So lots of water. Um, Elevating your feet helps get rid of our non-friend gravity, and that'll help get some of that fluid out. And I am a big proponent of compression socks.
Okay.
So those can be worn by anyone, anytime. And they just kind of help to support the lower legs and help prevent some of that swelling from just setting in. Yeah.
Okay. Okay. So one thing I know that you had for moms was a guide on how to do a self lymphatic massage. What is that all about, and how does a mom do it?
So what I recommend is you can do it once a day. You don't have to overdo it. And you want to just set out maybe like 5-10 minutes to do it. So you would start by taking a few deep breaths in through your nose, out through your mouth, which helps to stimulate the lymphatic system in our abdomen. And then you would go through the guide. Once you finish the self massage, you want to start chugging your water. If you're
Okay.
wearing compression socks, you would want to put them on at that point. And then you would want to do, some light exercising afterwards to
Okay.
kind of help pump that lymphatic fluid from those swollen legs.
Okay. So for moms that want this handout that Lauren is talking about, just comment massage if you're watching live or if you're watching the replay, and Lauren can email that to you so that you have that. And you don't have to be pregnant. Anybody can do it. I know I was talking to her earlier about I pulled a muscle while I was running the other day, and just in like right in my hip area, and she's like, you need to do a massage, a lymphatic massage. And I'm like, okay, I'll do that.
Yes.
So what would you want moms to what do you want them to take away from this? Number one thing to take away.
I think when I reflect back on my pregnancy, especially my last one, my little one is 3. I hadn't gone through my certification course yet. I didn't know any of the things that I know now. I would just tell mamas not to suffer. Like, yes, swelling in pregnancy and pelvic pain and engorgement and all that non-fun stuff is very common. But just because it's common doesn't mean it's normal. And it certainly doesn't mean that you have to suffer.
Yeah. Yeah.
When we know that there's a very gentle, relaxing technique that can be done to help.
Yeah. So for moms that are not in Knoxville, because we have a lot of moms all around the country in this group, if you're in Knoxville, find Lauren. If not, how does a mom find a certified lymphedema therapist? Like, is there a way to look for one, like a directory?
Yeah, so there is a national lymphedema network, the NLN. So you can go on there and you can find lymphedema therapists through there. The school that I took my course through is Academy of Lymphatic Studies. You can find therapists through there as well. Um, And that way, you know that you're getting somebody who has taken proper training and knows what they're doing.
Yes.
Yeah, those are the two big ones.
Okay. That's really interesting. Yeah. I mean, I knew a little bit, when we started talking, but this interview has been so educational for me. So,
Yay.
and I mean, heck, that's what we're here to do. So Lauren's business is actually Best Life OT, right? That's
Yes.
what it is. Okay. So her Instagram, I'm gonna put all of this information in this post when you're watching the replay, but it's Best Life Occupational Therapies for Instagram. I will put the link to her Facebook profile as well as her website, so you can see all that on there. And if you're interested in getting her handout, just comment massage. So we have a couple of people that have commented, so that's good. So we've got some mamas that are looking forward to getting your handout on self massage, and I'm gonna have to do that for my pulled muscle.
Yes.
All right,
Yes.
Lauren, well, thank you so much for being here with us this evening and sharing all that great information and education. And I know that, like I said, I didn't know about it, so I'm sure there's a lot of moms in this group that don't either, and so they're going to be learning as well. So we really appreciate you sharing all of this with us.
Absolutely. It's my pleasure. If anyone can't find somebody, please feel free to email me, text me. I don't mind hopping on camera and going over stuff with you or answering any questions.
Wonderful. And Lauren is part of this group as well. So feel free if you have questions. She will absolutely see your questions in the if you comment on this post, or you can reach out to her directly. Either way, she'll get to you somehow. Somehow she will get to you. All right. Well, thanks, Lauren. And thanks, moms, for watching live, or if you're watching the replay, thanks for hopping in, and we will see you all next time. Bye.
Thank you.